Croup. Let's talk about it. Part 1. The term croup by itself is not necessarily a virus. Croup is a condition that's caused by a virus. The most common viruses that can lead to croup are parainfluenza, influenza, adenovirus, COVID, and RSV. Croup tends to affect children between the ages of 6 months and 3 years of age. With croup, the respiratory virus that they've caught causes an inflammation in the upper airway. We're talking about the airway from their neck down to like the opening of their lungs. Because children this age already have a pretty narrow airway as it is, any little bit of inflammation is going to make a really loud sound. So the typical things you're going to hear with croup are the loud barky cough,
Okay.
The other term that you hear a lot with croup is stridor, and that is an inspiratory, or when they breathe in, loud, high-pitched sound. In following videos, we'll talk through some of the complications of croup and the treatments. Croup, part 2. Let's talk about the main complication of croup that we worry about, respiratory distress. Does your child need to be seen by their pediatrician if you think they have croup? Yes. What are signs that suggest that you cannot wait for your pediatric appointment and you need to pack up in the car and go to the ER or call 911? First, let's talk about stridor. We talked about stridor in our last video. That's that loud sound when they breathe in, right? It's one thing to make that sound when they're upset and crying. It's another thing for them to be making that sound continuously when they're at rest. In the ER or the urgent care, they can do a nebulizer treatment, a mask over their nose that gives them a medication called racemic epinephrine, and that will help to open this airway to take that sound away. Other signs that the child is in respiratory distress is when you look at their breathing and they look to be working hard. So what you're going to see is that the child is pulling in air with difficulty. One thing that you might see is right here in their neck, this crease in their neck, it sinks in every time they inhale. That's tracheal tugging. We don't want that. You might see that the nose flares every time they try to take in air. I don't know why my eyebrows are going up too. Every time they try to take in air, that could be a sign of respiratory distress. If you lift up their shirt, and you can see the skin sinking in between their ribs every time they try to breathe in, again, like they're pulling for air, or their chest wall is going in and out very fast. Respiratory distress. You're not going to wait. They have to get to the ER right away. Here's an example. In part 3, we're talking about management that you can do at home for croup. Croup número 3. Let's talk about treatment. So in previous videos, we already discussed what croup is, how it comes about, and what the signs of respiratory distress are to look for that suggests you don't need to wait to be seen. So let's talk today about how it's treated. Remember, we said that if your child does have a croupy cough, it's probably best to call your pediatrician, let them know to see if they want to be seen. What does the pediatrician do when you get there? Typically, we of course do a physical exam. We listen to their heart, their lungs, check their oxygen, make sure that they're hydrated, that they're breathing well. If everything looks good, then usually the typical treatment is a one-time dose of an oral steroid. What the steroid does is it helps decrease inflammation in this upper airway, which will help calm the cough down and help calm that barky sound. It's only given one time during the course of croup. Aside from that, what are things that you can be doing at home to manage croup? Remember, it's caused by a respiratory virus, so you always want to do your typical respiratory virus care. Saline, baby saline drops or spray, and suction. They can't blow their nose well, and clearing out their nose really helps their symptoms. A humidifier in the room at night when they're sleeping. When they breathe that mist in, it helps them sleep better and breathe better at night. Make sure that they're hydrated. Fluids are very important when they're sick, especially if they have a fever. Specifically for croup, those Those symptoms tend to get worse in the middle of the night. If your child does wake up in the middle of the night and they're having that croupy cough and you feel like they're struggling, the best thing to do is to take them outside in the cold air. There's been studies that show that 30 minutes of cold air really helps the symptoms of croup. We used to say that an alternative to that was to take them in the bathroom, turn on the hot shower, and close the door, and the warm mist helped. But studies have shown that the warm, humidified air does not help. Really, it's more the cold air. If you have any more questions about croup or anything that I am missing, please feel free to comment below.